Diabetes mellitus, also known as diabetes, is a metabolic disorder that causes high blood sugar levels. The hormone insulin transports glucose from the blood into the cells, where it is stored or utilized for energy. Diabetes is characterized by inadequate insulin production or ineffective insulin utilization. This video is for general information purposes and does not contain any medical advice. Please visit a doctor for proper diagnosis and treatment. Several distinct types of diabetes exist. Type 1 diabetes is an autoimmune disease. The immune system attacks and destroys insulin-producing pancreatic cells. It is unknown what triggers this attack. Type 2 diabetes occurs when the body develops insulin resistance and blood sugar levels rise. Type 2 diabetes is the most common form, affecting 90% to 95% of people with diabetes. Gestational diabetes is characterized by high blood sugar levels during pregnancy. This type of diabetes is caused by hormones produced by the placenta that inhibit insulin. Diabetes insipidus is a distinct condition in which the kidneys remove an excessive amount of fluid from the body. This video will focus predominantly on type 1 and type 2 diabetes. Prediabetes is a condition in which blood sugar levels are higher than normal but not high enough to be diagnosed as type 2 diabetes. This can eventually lead to type 2 diabetes. Symptoms of diabetes are caused by rising blood sugar levels. Type 1 diabetes. Type 1 diabetes symptoms may include extreme hunger, enhanced thirst, unplanned weight loss, frequent urination, hazy vision, tiredness. It may also cause mood shifts. Type 2 diabetes symptoms may include augmented hunger, enhanced thirst, more frequent urination, hazy vision, tiredness, wounds that heal slowly. It may also result in repeated infections. This is because high glucose levels hinder the body's ability to heal. Diabetes symptoms can be so subtle that they are initially difficult to recognize. What causes diabetes? Each type of diabetes is associated with a unique set of causes. Doctors are unsure of the exact cause of type 1 diabetes. The immune system mistakenly attacks and destroys beta cells in the pancreas that produce insulin. Genes may play a role in certain individuals. It is also possible for a virus to trigger an immune system response. Type 2 diabetes is caused by both genetic and lifestyle factors. Additionally, being overweight or obese increases your risk. Carrying excess weight, particularly in the abdomen, makes cells more resistant to the effects of insulin on blood sugar. This condition is inherited. Family members share genes that increase their susceptibility to type 2 diabetes and obesity. Diabetes risk factors. You are more likely to develop type 1 diabetes if you are a child or teenager, if a parent or sibling has the condition, or if you carry certain disease-linked genes. Type 2 diabetes, have excessive fat, are age 45 or older, have a parent or sibling with the disorder, lack physical activity, have a history of gestational diabetes, have prediabetes, have hypertension, elevated cholesterol, or elevated triglycerides. Diabetes-related complications. High blood sugar wreaks havoc on the body's organs and tissues. The longer you have diabetes and the higher your blood sugar, the greater your risk for complications. Among the complications associated with diabetes are cardiovascular illness, heart attack and stroke, nephropathy, retinopathy and visual impairment, hearing deficit, foot damage, such as infections and unhealed sores, skin disorders including bacterial and fungal infections, depression, dementia. Treatment of type 1 diabetes. Insulin is the primary treatment for diabetes type 1. It substitutes for the hormone your body cannot produce. People with type 1 diabetes typically use a variety of insulin formulations. They differ in terms of their onset of action and duration of effect. Treatment of type 2 diabetes. Diet and exercise can assist certain individuals in managing type 2 diabetes. If changes to your lifestyle are insufficient to lower your blood sugar, you will need to take medication. These medications lower your blood sugar in numerous ways. Diabetes and diet. Diet is central to the management of diabetes. In some instances, dietary changes may be sufficient to manage the disease. Type 1 diabetes. Your blood sugar rises or falls depending on the foods you consume. Sugary or starchy foods cause a rapid rise in blood sugar levels. Protein and fat result in slower increases. Your medical team may advise you to restrict your daily carbohydrate consumption. You must also balance your carbohydrate intake with your insulin dosages. Type 2 diabetes. Eating the right kinds of foods can help you control your blood sugar and lose weight. Carbohydrate counting is an essential component of a type 2 diabetes diet. A dietitian can assist you in determining how many grams of carbohydrates you should consume at each meal. Keto diet for diabetics and pre-diabetics has been proven to be extremely beneficial in reducing blood sugar levels in diabetics and normalizing blood sugar. To get your very own customized keto diet meal plan for diabetics and pre-diabetics alike, click on the link at the bottom of the video. To maintain stable blood sugar levels, try to consume several small meals throughout the day. Consume nutritious foods such as fruits, vegetables, complete grains, lean proteins like chicken and fish, wholesome fats like olive oil and nuts. Diabetes and workout. In addition to diet and medication, exercise is an essential component of diabetes management. This applies to all forms of diabetes. Physical activity improves cellular insulin sensitivity and reduces blood sugar levels. The general recommendation for people with type 1 or type 2 diabetes is 150 minutes of moderate intensity exercise per week. There are currently no separate exercise recommendations for pregnant women with diabetes. To avoid overexertion, pregnant women should begin slowly and gradually increase their activity level over time. Exercises suitable for diabetics include walking, swimming, dancing, cycling. Discuss safe ways to incorporate physical activity into your diabetes management plan with your physician. You may need to take special precautions, such as monitoring your blood sugar before and after exercise and staying hydrated. Diabetes diagnosis. Everyone with diabetes symptoms or at risk for the disease should be tested. These blood tests are used by physicians to diagnose pre-diabetes and diabetes. The fasting plasma glucose test measures your blood glucose after an 8-hour fast. The A1C test provides a snapshot of your average blood glucose levels over the past 3 months. Diabetes treatment. Type 1 diabetes cannot be prevented because it is caused by an immune system problem. Some causes of type 2 diabetes, such as genetics and age, are also beyond your control. However, many other risk factors for diabetes are manageable. The majority of diabetes prevention strategies involve dietary and physical activity modifications. If you have been diagnosed with pre-diabetes, you can take the following steps to delay or prevent type 2 diabetes. Participate in at least 150 minutes of aerobic exercise per week, such as walking or cycling. Eliminate saturated and trans fats from your diet, along with refined carbohydrates. Eat more whole grains, fruits, and vegetables. Consume smaller portions. Attempt to lose between 5 and 7% of your body weight if you are overweight or obese. These are not the only methods of diabetes prevention. Diabetes in children. Diabetes of both types can affect children. Diabetes can cause damage to vital organs such as the heart and kidneys, making it crucial for young people to control their blood sugar. Type 1 diabetes. Autoimmune diabetes typically begins in childhood. One of the primary symptoms is an increase in urination frequency. After becoming toilet trained, children with type 1 diabetes may begin bedwetting. Extreme thirst, exhaustion, and hunger are additional symptoms of the condition. It is crucial that children with type 1 diabetes receive treatment immediately. The condition can result in high blood sugar levels and dehydration, both of which are medical emergencies. Type 2 diabetes. Type 1 diabetes was once referred to as juvenile diabetes because type 2 diabetes was so uncommon in children. Now that more children are overweight or obese, the prevalence of type 2 diabetes in this age group is increasing. Certain children with type 2 diabetes do not exhibit symptoms. Others may encounter enhanced thirst, frequent urination, extreme fatigue, hazy vision. It has been proved that the keto diet for diabetics and pre-diabetics is extremely beneficial for lowering blood sugar levels and normalizing blood sugar in diabetics. Click the link at the bottom of the video to get your personalized keto diet meal plan for diabetics and pre-diabetics right away. If you liked today's video, then feel free to smash the like button and subscribe to our channel.